Emory Healthcare is more than a medical system. It's a lifesaver. When I first noticed my symptoms of the disease that I had that ultimately led to me having a lung transplant was at the beginning of 2024.
When his condition first began, we really didn't have any signs. Everything was normal, and then it wasn't.
I came down with pneumonia and was admitted to the hospital. I was finally discharged after nearly 2 weeks and was put on supplemental oxygen. They were able to identify that I had pulmonary fibrosis. Some of the moments that I had almost lost hope is when I was educating myself and realizing there was no cure. I thought about my family, and particularly my children. Was I going to be able to see them graduate? Was I going to see the last baseball game?
He was already starting to require a significant amount of oxygen. Given his amount of oxygen age, we were all very concerned, and we decided to move fast towards an evaluation for lung transplant.
November 3rd of 2024, I received the most special call of my life. I was able to get a donor, and then we had our surgery for our double transplant. I felt comfortable going into the surgery knowing that Emory had a bunch of professionals that I trusted and my family trusted. And it gave us a sense of comfort and confidence going into this surgery.
Cliff had an incredible journey. He recovered very quickly.
The Mason Guest House was an opportunity to still be up under the care of my doctors on campus, but be away from the hospital. It gave me a sense of independence. It allowed me to talk to other individuals who also had transplants.
We are lucky to have a dedicated staff and dedicated gym where they can go for their pulmonary rehab. Meredith has been incredibly helpful in guiding this patient and make sure that they regain their strength within the first month.
When you're ready, you can go ahead and get started.
The goal of physical therapy, and pulmonary rehab specifically, is to help aid a patient in getting back on their feet. So once he went through transplant, came back around on the post-transplant side, Cliff came in looking wonderful. I think it was by the fourth visit or so, he was walking a mile around the track at a time without having to stop.
Work on taking your deep breaths as you're walking.
I think it's just the people that work at Emory Healthcare, they care. They probably do it without thinking. Because of Emory Healthcare, we're making plans for the future, and it feels fantastic.
We don't even think about the breaths that we take under normal circumstances. Now that I've had the opportunity to have this transplant, it makes me think about what breathing is and what life truly is. I don't take it for granted.